Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, founder and chief medical officer of Atlantic Coast Aesthetics. And in this week's Ask Dr. Pane question, where Dr. Pane will answer your cosmetic surgery questions live on the air, we have a question from Miami. And Dr. Pane, the question is, will an outer thigh implant correct a liposuction procedure that caused a little bit of damage? Dr. Pane, what would you suggest in this situation?
Well, this is a really good question to answer because we don't often talk about what can go wrong with liposuction. In this case, it looks to me that the person had outer thigh lipo, and I'm not a huge fan of that procedure unless the outer thighs are really bulged out quite a lot. Because we forget that what we're trying to do is enhance the silhouette. And when you do outer thigh lipo, you reduce that hip width. And that kind of takes away from the kind of golden ratios we're trying to give people. But if there's a real big bulge, it can be reasonable. So here what happened was they probably went from above and below and created a lateral groove on the outside of the thigh. And I'm just going to say, this is one of the trickier things and harder things to try to deal with. The person is not a big fan of fat grafting. Understandably, they probably didn't have a great experience with lipo. But here, fat grafting is actually going to give you the highest percentage for good success, although it's going to take probably more than one procedure. And not everyone does this. So you just have to check around to find that you're really going in for a consult with someone that actually can do this or is willing to do this, because some people don't, and they probably shouldn't be. But what would be done here would be releasing that scar and grafting it. Now, if they don't want that, an implant is possible. An implant has got its own set of issues, and it might have to be a customized implant depending on the dimensions of the problem. And it's going to require a larger scar to put that in. It also will be something you can feel. The other option, a third way to handle it, would be doing what they call the dermal fat graft, which also has potential issues, but can be done, and usually take a strip of tissue if you're doing a thigh lift or a tummy tuck or some other excisional procedure. You use that tissue to fill in that defect. Again, these are not perfect options, but they are all potential ways to handle what's going on here. And you couldn't say for sure which one would be best without seeing the person, for a live consultation, and then really assessing the kind of problem that there is, how deep it is, how large it is, and what they're willing to try in order to improve the situation. But not to scare people off from outer thigh lipo. It's fine to do if you're using a small cannula, you've got a lot of fat there to begin with, and the person doing it is very cautious and knows what they're doing with liposuction. But in this case, it was just a little too much. Maybe they used the wrong cannula, the wrong person was doing it. But I think the problem can be improved, but it's a little involved, and it would require an in-person consultation. Those are your three basic options: fat transfer, implant, or what they call dermal fat graft. Those are the three. So I hope that helps to sort it out, and good luck to them, and we'll see. Hopefully somebody can help them out.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website, Instagram, or Facebook. And Dr. Pane, we'll see you on the next question.
Great.